Now, anyone who suffers from migraine will know how debilitating the condition can be. 1 in 7 adults in the UK suffers from them in what is classed as a disabling illness. The Migraine Trust estimates that over 1 million people have chronic migraine, which means they experience symptoms for at least 15 days a month. And the effects last for between 4 and 72 hours. Well, in Sussex at least, some relief is available as an NHS service there offers people faster access to specialist care and new treatments. Our health correspondent Mark Norman has been finding out.
The pain can be unbearable. But migraine doesn't just hurt your head.
Migraine can be completely debilitating and at its worst ruin lives. Paul has lived with migraine since he was 10 years old.
I think the worst times are when I'm violently sick. It can just be so painful and you don't feel as though there's anything you can do.
Staff at the Sussex Migraine Clinic are caring for around 800 patients in similar situations.
I've had patients who have decided not to have children because that meant they would come off their preventative treatment, which would put them into a position where they couldn't work. They'd be in so much pain. We've had patients who have lost friendships and relationships because the unpredictable nature of the disorder means that they don't know if they're going to be well, and they often have to cancel things. And by being able to facilitate these new drugs for patients, we're seeing that's happening less and less. Patients are getting their lives back. It's been revolutionary.
Two things have changed. We've seen the introduction of the first medications specifically targeting migraine, including oral treatments, infusions and injections such as Botox. And secondly, the fact that patients can now access these treatments earlier through their GP with recommendations from a specialist.
We know that in brains of patients who have migraine have an abundance of a chemical called CGRP. And we've known that for decades, and what these new treatments do is to target that CGRP chemical and can block it. I mean, what's amazing is that we've had patients who have tried lots of treatments and have not responded to them, and then when these new therapies that targeted CGRP took this, it had helped their migraines immensely and it's transformed their lives.
What things for you?
There are days when I feel odd because I don't have any form of headache. So that's a big bonus.
There is an ongoing national campaign for increased awareness of migraine, while the migraine pathway developed by NHS staff in Sussex has received national recognition with plans to adopt the ideas across the South East. Mark Norman, BBC South East Today, Brighton.